Chapter 7 Beta lactam antibiotics. Beta lactam antibiotics. Beta lactam antibiotics are a class of broad spectrum antibiotics consisting of all antibiotic agents that contain a beta lactam ring in their molecular structure. These include penicillin derivative penams, cephalosporin, cephams, monobacterium, and carbapenems. Most beta-lactam antibiotics work by inhibiting cell wall biosynthesis in the bacterial organism and are the most widely used group of antibiotics. Beta-lactam ring. Beta-lactam antibiotics contain a beta-lactam ring in their molecular structure. Nitrogen is attached to the beta-lactam relative to the carbonyl ring and hence the name. History. Starting in the late 19th century, there had been many accounts by scientists and physicians on the antibacterial properties of the different types of molecules, including the mold penicillium, but they were unable to discern what process was causing the effect. The effect of penicillium mold would finally be isolated in 1928 by Scottish scientist Alexander Fleming in work that seemed to have been independent of those earlier observations. Fleming recounted that the date of his discovery of penicillin was on the morning of Friday, 28 September 1928. The traditional version of the story describes the discovery as a serendipitous accident. In his laboratory in the basement of St. Mary's Hospital in London, now part of Imperial College, Fleming noticed a petri dish containing Staphylococcus that had been mistakenly left open was contaminated by blue-green mold from an open window, which formed a visible growth. There was a halo of inhibited bacterial growth around the mold. Fleming concluded that the mold released a substance that repressed the growth and caused lying of the bacteria. When Fleming made his discovery, he grew a pure culture and discovered it was a penicillium mold, now known as Penicillium chrysogenum. Fleming coined the term penicillin to describe the filtrate of a broad culture of the penicillium mold. He expressed initial optimism that penicillin would be a useful disinfectant because of its high potency and minimal toxicity in comparison to antiseptic of the day. Despite the lack of interest of his fellow scientists, he did conduct several experiments on the antibiotic substance he discovered. The most important result proved it was monotoxic in humans by first performing toxicity tests in animals and then on humans. His following experiment on penicillin response to heat and pH allowed Fleming to increase the stability of the compound. The one test that modern scientists would find missing from his work was the test of penicillin on an infected animal, the result of which would likely have sparked great interest in penicillin and spread its development by almost a decade. In 1940, penicillin was isolated in the form of a brown impure powder and was the most powerful chemotherapeutic agent known at that time. Since then, more than 40 penicillin have been identified. Some occur naturally, others are biosynthesized. In 1945, cephalosporin acrimonium, cephalosporium acrimonium was isolated from raw sewage. The first cephalosporin C, was derived from this fungus. All other cephalosporin are semi-synthesized antibiotic derivatives of cephalosporin C. The first cephalosporin was available for clinical use in 1964. Although penicillin and cephalosporin are still the most commonly used beta-lactam antibiotics, much progress has been made in the development of new beta-lactam during recent years. Most notably, these include the beta-lactamase inhibitors, example clavulanic acid, the carbapenemins, impenemum, and the monobactam atrionam. Unit of penicillin. Units of penicillin. The dosage of penicillin G, natural penicillin, is usually expressed as international unit. The international unit IU for penicillin has been identified as the amount of activity present in 0.6 mg of the international pure crystalline standard sodium salt of penicillin G. 1 mg contain 1667 Oxford unit. The dose of more recent beta-lactam antibiotics or synthetic penicillin is expressed in milligram per unit of body weight rather than in international unit. Physiochemical properties. Physiochemical properties. The essential penicillin molecule contain a fused ring system. The beta-lactam thiazolidine. The physical and chemical properties, especially solubility of penicillin, are related to the structure of the acyl side chain and the action used to form salt. Hydrolysis is the main cause of penicillin degradation and can take place in the syringe when penicillin is mixed with another drug. Some penicillin are rapidly hydrolyzed by gastric acid, making them unsuitable for oral administration. Aqueous solution of the alkaline sodium salt of sulfonamide inactivate penicillin. Penicillin is incompatible with heavy metal ion, oxidizing agent, and strong concentration of alcohol. Classification of penicillin. Classification of penicillin. Penicillin are classified into various groups based on their source. Natural penicillin. Natural penicillin. Soluble sodium or potassium salt of benzyl penicillin. Penicillin G destroyed by gastric acid, orally inactive and degraded by penicillinase enzyme. Given IM, IV, and SC. Onset of action within half an hour and duration of action only 3 hours. Sparingly soluble organic salt of penicillin G or repository penicillin. Procaine penicillin G. Procaine penicillin G. Administered IM, never IV. Onset of action within 6 to 8 hours. Destroyed by gastric acid and by penicillinase, and duration of action 12 to 24 hours. Incident of hypersensitivity most common. Benzathine penicillin G. Benzathine penicillin G. Administered IM, never IV. Onset of action slow and duration of action 1 week. Semi-synthetic penicillin. Acid resistant penicillin. Phenoxymethyl penicillin. Penicillin 5. Phenoxyethyl penicillin. Penicillin resistant penicillin. Penicillinase resistant penicillin. Acid labile penicillin. Methicillin and nafacillin. Acid resistant penicillin. Flucloxacin, oxacillin, and dicloxacin. Extend spectrum penicillin. They are not penicillinase resistant. Aminopenicillin, effective against gram positive and gram negative bacteria. Ampicillin, becampicillin, talampicillin, pivampicillin, and amoxicillin. Carboxypenicillin, anti-pseudomal penicillin. These are active against Pseudomonas aeruginosa and Proteus. species but ineffective against Klebsiella and gram-positive cocci, carbancillin and ticarcillin. Duridopenicillins, active against Pseudomonas and Klebsiella, mesalazine and piperacillin. Amidinopenicillins, amidinopenicillin, amidinopenicillin, mequilinum and puermequilinum. These are highly active against gram-negative bacilli, E. coli, Salmonella, Klebsiella, and Enterobacter, but not against Pseudomonas and gram-positive cocci. Penicillinase-resistant penicillins have a ring structure attached to the carbonyl carbon of the side chain. Substitute on the ring protect the lactam ring from beta-lactam. Extended spectrum penicillin have either a carboxylic acid group or a basis group at the alpha position at R, which give this drug a wider spectrum of activity than the order 3 group of penicillin. Mechanism of action. First, cell wall synthesis inhibitor in growth medium. Second, third, fourth. Spheroblast. Bacteria that attempt to grow and divide in the presence of penicillin fail to do so and instead end up shedding their cell wall. Beta-lactam antibiotics bind PBP, inhibit cross-link of peptidoglycan, cell wall deficient bacteria, and glycolysis bactericidal effect. Mechanism of action of penicillin. The gram-positive bacteria cell wall comprised of peptidoglycan having linear strand of two alternating amino sugar, N-acetylglycosamine (NAG) and N-acetylmuramic acid (NAMA), which are cross-linked by peptide chain transpeptidation and give rigid mechanical stability to the cell wall. Beta-lactam antibiotics extract their bactericidal effect by preventing bacterial cell wall synthesis and disrupting bacterial cell wall integrity. Beta-lactam bind to a series of enzymes, transpeptidase and protein known as penicillin binding proteins, which are involved in the final stage of cell wall synthesis. The beta-lactam ring is a structure analog to the final peptide bridge, D-alanine, that cross-link the peptidoglycan chain that composes the bacterial cell wall. Penicillin binding proteins vary between bacterial species. The affinity of various beta-lactam antibiotics for the different penicillin binding protein explain difference in spectra of activity of beta-lactam antibiotics that are not caused by the presence or absence of beta-lactamase. Gram-negative bacteria can have up to 7 different penicillin binding proteins on their cell membrane, each of which involved in different catalytic reactions. The binding of a beta-lactam antibiotic to a penicillin binding protein lead to the formation of defective cell wall that osmotically unstable. Cell death usually results from lysis, which may be mediated by bacterial autolysis. The beta-lactam antibiotic demonstrated a post-antibiotic effect against gram-positive cocci but not against gram-negative bacilli. Microbial resistance. 3 independent factors determine the bacterial susceptibility to beta-lactam antibiotic. They are production of beta-lactamases, permeability of cell wall, sensitivity of the penicillin binding protein, the elaboration of beta-lactamase enzyme that inactivate the drugs by hydrolyzing the beta-lactam ring is the major mechanism of drug resistance. Different bacteria produce beta-lactamase that differ in physical, chemical, and Functional properties. Some beta-lactamases are specific for penicillinase. Some are specific for cephalosporinase, while still others have affinity for both groups. There are two mechanisms of beta-lactamase production. They are chromosomal plasmid. Chromosomally derived beta-lactamases are species and genus specific and can be induced by the presence of any beta-lactam compound. Plasmid-derived beta-lactamases can be transferred between bacteria, increasing the number of bacteria resistant to the antibiotic. Gram-positive bacteria generally produce chromosomally derived beta-lactamases. Those produced by gram-negative bacteria are chromosomally derived or plasmid-mediated. The chromosomally derived beta-lactamases produced by gram-negative bacteria are primarily cephalosporinase, while the plasmid-mediated ones are generally broader spectrum. Gram-negative bacteria secreted a small amount of beta-lactamase into their periplasmic space, allowing for optimal location of the enzyme to degrade the beta-lactam upon entry into the organism. Newer agents have increasing resistance to beta-lactamase. For example, the cefamycin, cefoxitin, and cefotaxime are apparently stable to chromosomally mediated beta-lactamase, which may give them their excellent activity against anaerobic gram-negative rod. Gram-negative bacteria can produce a cell wall with a modified outer membrane that is no longer permeable to beta-lactam antibiotics. This mechanism can enhance the resistance produced by the elaboration of beta-lactamase, but it is not sufficient to markedly increase resistance by itself. Bacteria have an intrinsic resistance to beta-lactam because of reduced sensitivity of the penicillin binding protein and failure of the drug to inhibit the operative pathway of cell wall formation. Microbial susceptibility. Natural penicillin. The natural penicillin are active against many streptococci species and non-penicillinase producing staphylococci species. They are active against some gram-positive and gram-negative bacilli, including Cyanobacterium, Listeria monocytogenes, Pasteurella multocida, and Haemophilus influenzae. Natural penicillin are active against many gram-positive and gram-negative anaerobic bacteria, including Fusobacterium, Staphylococcus, and some strain of Clostridium. Natural penicillin are also active against most spirochetes, including Leptospira and Borrelia burgdorferi. Natural penicillin are inactive against Pseudomonas, most Enterobacteriaceae, and penicillinase producing Streptococcus species. Aminopenicillins are generally active against the microbes that are susceptible to natural penicillin. They are also active against some Enterobacteriaceae, include strains of E. coli, Proteus mirabilis, and Salmonella. Aminopenicillin are inactive against Pseudomonas, bacteroides, fragiles, and penicillinase producing Staphylococcus species. Penicillinase-resistant penicillin. The penicillinase-resistant penicillin are active against many penicillinase-producing Staphylococcus species, which are resistant to the natural penicillin and the aminopenicillin. Penicillinase-resistant penicillin also have some activity against other gram-positive and gram-negative bacteria and spirochetes. However, they are generally less effective than the other penicillin. Extended spectrum penicillin. Extended spectrum penicillin. Extended spectrum penicillin have the most activity against gram-negative aerobic and anaerobic bacteria of all of the penicillin group. The drugs are active against many strains of Enterobacteriaceae and some strains of Pseudomonas. Carbancillin and ticarcillin are active against some strains of E. coli, Morganella morgani proteus species, and Salmonella. In addition to these organisms, Magillocillin and Piperacillin are active against some strains of Enterobacter, Citrobacter, Klebsiella, and Serratia. The extended spectrum penicillin have some activity against gram-positive aerobic and anaerobic bacteria but are generally less effective against these organisms than are the natural penicillin and aminopenicillin. Extended spectrum penicillin are generally more active against bacteroids fragile than are other available penicillin. Pharmacokinetics. Most penicillin are rapidly absorbed which, when injected in aqueous suspension by the IM or ISC route, maximum blood concentration result in 50-30 minutes. IM injection is the most common route of administration. It is necessary to orally administer 5 times the amount of penicillin G necessary for IM injection to produce comparable blood concentration because of inactivation by the gastric acid and enteric bacteria. Absorption of penicillin occurs during the first few hours after intramammillary infusion. Blood concentration are consistently higher when penicillin is infused in infected quarters than when infused into normal quarters. Serum play a significant role in transfer of penicillin from treated to untreated quarters. There is systemic absorption of sodium benzylpenicillin and procaine benzylpenicillin administered intrauterine to horse and cattle respectively. Sodium or potassium penicillin suspended in an inert oil prolonged absorption of penicillin from the site of infection for approximately 18 hours. Incorporation of the poorly soluble procaine penicillin in oil prolongs absorption for 24 or more hours. Addition of 2% aluminum monostearate to a suspension of penicillin in oil produces a gel with a high degree of water repellency, with markedly slow absorption of procaine penicillin suspended in the medium. Although the use of an oil vehicle helps to prolong the duration of therapeutic blood concentration, undesirable physical properties limit widespread use. Horse may show unfavorable acute and chronic tissue reaction to the parenteral administration of an antibiotic in an oil vehicle. Procaine penicillin G is a buffered aqueous suspension available for IM injection. Procaine prolongs the absorption of penicillin from the site. Absorption of procaine may become problematic in drug testing program used in racing horse. A small amount of sodium or potassium penicillin G may be added to establish a therapeutic concentration immediately following IM injection. Benzathine penicillin G is a repository salt of penicillin. Benzathine penicillin G is a repository salt of penicillin. Absorption of this compound may be prolonged for 7 or more days. Diffusion of penicillin into the tissue and fluid occurs as long as the unbounded plasma concentration exceeds that of the tissue and fluids. high concentration of penicillin are generally reached in kidney, liver, and lung. Penicillin do not penetrate the CNS to any great extent that penicillin will diffuse across the placenta into the fetal circulation. Tissue residue of penicillin in slaughtered animals are considered a public health hazard because of potential hypersensitivity reaction in people. Penicillin G, penicillin 5, norfacillin, ticarcillin, and the aminopenicillin are metabolized to some extent by hydrolysis of the beta-lactam ring. The metabolites are microbiologically inactive. Penicillin and their metabolites are excreted in the urine by tubular secretion. Most of the drug is excreted in the urine within 1 hour of IM injection of sodium or potassium penicillin in an aqueous solution. Probenecid competitively inhibit renal tubular secretion of penicillin. Probenecid competitively inhibit renal tubular secretion of penicillin. Penicillin also eliminated in milk. Penicillin in detail. Penicillins in detail. Natural penicillin. Penicillin G, benzyl penicillin. Penicillin G has narrow spectrum and is effective against gram-positive cocci, bacilli, and a few gram-negative coli. Thus, streptococci, pneumococci, ginococci, meningococci, bacillus anthracis, diphtheriasis, clostridial listeria, and spirochetes are highly sensitive. Also active against some anaerobics. Benzyl penicillin is destroyed by gastric juice. Acid labile has very low bioavailability, hence given parentally. Food interference with its absorption, hence should be given 2 hours before or after food. Procaine penicillin G should not be administered for because procaine can adversely affect the cardiac conduction system. Penicillin is usually not administered orally to herbivores because it suppresses bacterial metabolism in the digestive tract. The exception are those herbivores that are very young or animal that requires suppression of bacterial fermentation to prevent bloat. Penicillin is administered via both intramammary and systemic route to treat bovine mastitis. Milk contaminated with antibiotic may cause public health problem as well as inhibit the cheese making process. Penicillin in milk and milk product may sensitize susceptible human with subsequent penicillin therapy more likely to produce an allergic reaction. Recommended withdrawal time must be adhered to the type of vehicle used in intramammary infusion. Preparation is a factor that also determines time required for elimination of antibiotic via the milk. In general, penicillin in fat-soluble ointments or mineral oil vehicles persists longer in the bovine other than penicillin administered in an aqueous vehicle. In contrast, aqueous vehicle favor rapid release of antibiotic to attain maximum therapeutic concentration. This information is provided on the label. Adverse adverse effect. Adverse effect. Penicillin are highly safe drug with a high therapeutic index. Most adverse reactions are not serious in therapeutic dose except hypersensitivity reaction. Hypersensitivity is the most common cause of allergy. Degradation product of penicillin like phenyllicoic acid is antigenic. Allergic reactions range from skin rashes, urticaria, pruritus, fever, bronchospasm, serum sickness, and rarely exfoliative dermatitis and anaphylaxis. Through all from Though all forms of penicillin can cause allergy, anaphylaxis is more common following parenteral than oral preparation. A syringe loaded with adrenaline to treat anaphylaxis should be kept ready. Local pain at the site of IM injection due to irritation, thrombophlebitis on IV injection, particularly large dose due to irritation. CNS. Large dose of penicillin G greater than 20 mega unit injected IV may produce confusion, muscle twitching, convulsion, and coma, particularly in presence of renal disorder. Superinfection are rare because of narrow spectrum of penicillin. Repository penicillin. Repository penicillin. Oral penicillin can be used only in minor infection, and benzyl penicillin is short acting. Hence, repository penicillin like procaine penicillin and benzathine penicillin are formulated so that they are slowly absorbed with prolonged blood level and are longer acting. Give deep IM, they release penicillin slowly from the site. Procaine penicillin is given 12 to 24 hours, while a single injection of benzathine penicillin is effective for 3 to 4 weeks. Semi-synthetic penicillin, semi-synthetic penicillin, acid-resistant penicillin, acid-resistant penicillin, penicillin 5, phenoxymethylpenicillin is acid stable and can be given orally. Used only in mild infection as it has a low bioavailability, short action, 6-hour dosing, and a narrow spectrum of activity. It may be given in streptococcus, streptococcal pharyngitis, sinusitis, and trench mouth. Penicillin resistant penicillin. Penicillin resistant penicillin. Methicillin sodium is a water-soluble penicillinase resistant penicillin that produces therapeutic concentration in the CNS. Methicillin is primarily used as an anti-staphylococcal drug. However, methicillin is a powerful inducer for penicillinase, and staphylococci may develop resistance by non-penicillinase mechanism. Methicillinase is given by the IV or IM route and is usually well tolerated. Occasionally, some pain may be observed following IM injection. Oxacillin, cloxacillin, dicloxacillin, and naproxen resist acid hydrolysis and can be administered orally. Aminopenicillin, aminopenicillin, aminopenicillin. These are extended spectrum penicillins cover a wider antibacterial spectrum, including may gram-negative bacilli, orally effective but are sensitive to beta-lactamase. Ampicillin and amoxicillins have been used in the treatment of a variety of diseases in domestic animals. Half-life of all aminopenicillin is approximately 60 to 90 minutes. The tissue drug concentration may be higher than serum concentration. Following oral administration, ampicillin is more quickly absorbed when mixed with water or glucose solution than when added to milk or milk replacer. Amoxicillin differs from ampicillin by the addition of a para-hydroxy group. It has greater resistance to gastric acid and is more completely absorbed than ampicillin. Hydrocillin is prepared by a reaction of ampicillin with acetone. When administered as an aqueous solution, it is rapidly converted back to ampicillin and acetone. Thus, the spectrum of activity is identical to that of ampicillin. Extended spectrum penicillin. Extended spectrum penicillin. Extended spectrum penicillin. Carbanicillin and other members of this group have the major advantage that they are effective against Pseudomonas. protease, and other gram-negative bacteria resistant to other penicillin. Carpenicillin has a broad range of antibacterial activity that has been related to the carboxyl group substituted on the alpha carbon of the benzyl side chain. Carpenicillin is acid labile and must be administered currently. Carpenicillin indanyl, the indanyl ester of carpenicillin is acid stable and suitable for oral administration. It is rapidly absorbed from the small intestine and peak plasma concentration are achieved within 1 hour of oral administration. Carpenicillin is primarily eliminated by the renal tubules, with approximately 80% of the dose appearing in the urine within 9 hours. Peak serum carpenicillin concentration achieved following oral administration are low, and many infections are not treatable with this drug unless confined to the lower urinary tract. Ticarcillin and meslocillin are not absorbed orally and must be administered IV or IM. Toxicity. Penicillin are very safe drug with relative few adverse effects reported. Acute allergic reaction are the most common untoward effect in people. Acute anaphylaxis, collapse, hypersalivation, shaking, vomiting, urticaria, fever, eosinophilia, neutropenia, agranulocytosis, thrombocytopenia, leukopenia, anemia, and lymphadenopathy can occur in sensitized animal. Combs positive hemolytic anemia has been reported in horse following penicillin administration. The IV administration of hypertonic solution of sodium benzyl penicillin has resulted in ataxia and convulsion in cat and dogs. Procaine can also cause anaphylaxis and CNS disorders. Guinea pigs, chinchillas, bird, snake, and turtle are sensitive to procaine penicillin. Anorexia, vomiting, and diarrhea can occur when penicillins are given orally. Change in the intestinal flora induced by penicillin administration can also lead to diarrhea. Extended spectrum penicillin have been associated with coagulopathies in humans. The incidence of this is known in veterinary patients. Beta-lactamases are enzymes produced by penicillin-resistant bacteria which break the antibiotic into inactive penicilloic acid. They are named as beta-lactamases as they act by splitting the beta-lactam ring present in beta-lactam antibiotic, penicillin, and cephalosporin. These enzymes are of two types, penicillinase and cephalosporinase. Beta-lactamase inhibitor. Beta-lactamase inhibitor. This potentiate or re-establish the antibacterial potency of penicillinase sensitive penicillin against beta-lactamase producing organism by inhibition of the enzyme. Suicidal inhibition. These inhibitors are structurally similar to penicillin and act as substitute for penicillinase. Beta-lactamase causing inhibition of enzyme. These are clavulanic acid obtained from streptomycin clavuligerus. Streptomyces clavuligerus has no antibacterial activity of its own. It is generally combined with amoxicillin, augmentin, or ticarcillin, timentin. Sulbactam, a semi-synthetic beta-lactamase inhibitor, related chemically and in activity to clavulanic acid. It is combined with ampicillin and preferably for oral and parenteral administration. Tazobactam. Tazobactam. It is similar to sulbactam and combined with piperacillin. Potentiate penicillin. Potentiate penicillin. The penicillin in combination with beta-lactamase inhibitor are called as potentiated penicillin. The combination are clavulanic acid plus amoxicillin 2 is equal to 1, clavulanic acid plus ticarcillin 50 is equal to 1. Clavulanic acid, amoxicillin, clavulanic acid, amoxicillin, clavulanic acid, amoxicillin. Susceptibility. Excellent susceptibility of gram-positive bacteria, including beta-lactamase producing S or SS. Fastidious gram-negative bacteria and strain-resistant to amoxicillin are also susceptible. Enterobacteriaceae and most anaerobes are susceptible. Resistant. Some organisms like Citrobacter, Enterobacter, Pseudomonas, Serratia, MRSA are resistant. Antibiotic resistance. It may induce beta-lactamase production in some susceptible organisms. Hyperproduction of beta-lactamase reduce antibiotic uptake and production of resistant beta-lactamase are the various means of resistant development. Pharmacokinetics. Pharmacokinetics. It is well absorbed after oral administration and pharmacokinetics is similar to amoxicillins. Widespread distribution into extracellular space but penetration into milk and CSF is relatively poor unless inflammation is present. Its elimination half-life is about 75 minutes. It is eliminated largely unchanged in urine with some biliary excretion. Toxicity. Toxicity. It is well tolerated. Mild gastrointestinal upset has been reported in dogs and cats. The combination should not be used in penicillin or cephalosporin sensitive individuals. It should not be administered orally or herbivorous and by injection to horses. Clinical application. Clinical application. Cattle, sheep and goat, lower respiratory tract infection, anaerobic soft tissue infections and neonatal diarrhea caused by E. coli and salmonella. To treat clinical mastitis in cattle, both parenteral and intramammillary administration give good result. Pasteurizations in sheep, swine, neonatal diarrhea caused by E. coli. Dog and cat, mixed infection, lower respiratory tract infection, anasacculitis, gingivitis, urinary tract infection and peritonitis due to intestinal spillage. Clavulanic acid, ticarcillin. Clavulanic acid, ticarcillin. Clavulanic acid, ticarcillin. It has greater activity against Enterobacter and Pseudomonas aeruginosa and majority of ticarcillin resistant organisms. It is available for IV administration and need frequent dosing at 8-hour interval. Sulbactam, penicilloic acid sulfone. Sulbactam, penicillinoic acid sulfone. It is a synthetic derivative of 6-aminopenicillinoic acid. It is poorly absorbed orally, but its product sultamicillin is well absorbed orally. It has no antibacterial activity by itself, but irreversibly bind to beta-lactamase. The affinity of sulbactam is lower compared to clavulanic acid. It is combined with ampicillin because of similar pharmacokinetic properties and with ceftriaxone. Sulbactam ampicillin. Sulbactam ampicillin antibacterial activity is broader but lower than clavulanic acid. Amoxicillin combination. It is poorly absorbed orally and is available as prodrug for oral use. The combination is well absorbed after intramuscular use, is well distributed into extracellular space, and enters the CSF through inflamed meninges with a half-life of 1 hour. Injection may be painful otherwise. It is well tolerated. It should not be used in hindgut digested like horse, rabbit, etc. Clinical usage. Clinical usage: bovine respiratory disease, extra label use for salmonellosis. Tazobactam. Tazobactam. Its activity is broader than clavulanic acid and sulbactam. It resists hydrolysis by some beta-lactamase. It is combined with piperacillin in a ratio of 8:1. Piperacillin tazobactam and has enhanced activity against Pseudomonas. Piperacillin tazobactam. It possesses broad spectrum of activity against many Enterobacteriaceae and other gram-negative bacteria. It is also active against anaerobics and gram-positive organisms. It is used to treat polymicrobial infection and is effective like imipenem or clindamycin, gentamicin, along with aminoglycoside. It is used to treat fever in neutropenic patients. Thank you.